For the second time ever in the U.S., a human being has contracted bird flu. Here's what we know. Health officials say the person had direct exposure to cows, and presumably those cows also had the virus. There has been a recent outbreak among dairy cows in particular, spreading to at least 4 states, with a 5th state reporting a possible case. To help us sort this all out, Dr. Celine Gounder is here. She's a CBS News medical contributor and editor-at-large for public health at KFF. Dr. Gounder, thank you very much for being here. Once upon a time, we'd see a headline like this, and people would kind of ignore it. It would go away eventually. But post-COVID, now we're all concerned, right? So this person who's contracted bird flu for the second time, what do we know about their condition, and how concerned should people be?
Well, again, I think it's important to emphasize this is only the second case we've ever seen of H5N1 bird flu in the United States. The first was in Colorado in 2022. This person has a very mild case, just conjunctivitis, which is pink eye. And that's important to emphasize because it's not in the lungs. It's not pneumonia, which would make it easier to transmit from person to person.
So we should not be that concerned? How concerned should the general person be?
The average person does not need to be worried.
Right.
If you have been in contact with an infected bird or an infected cow, or you've had direct contact with somebody who has this, then you need to be concerned. But for the general public, there's really very low risk at this stage.
Should we be worried about the meat supply or the milk supply?
Well, in terms of the milk supply, they are disposing of milk from the infected cattle. They are being isolated. Remember, isolation from COVID. They're doing the same thing with the cows so that they don't infect the rest of the herd. And then it takes about 7 to 10 days for the cows to recover. So they wait, and then once they've recovered, they return to the rest of the flock. In terms of the meat supply, again, because the cows recover, they don't have to cull the cattle. They just need to wait until they recover.
So Tony asked about the concern of the public. Should we even be thinking about a vaccine for something like this?
We're quite a ways from having a vaccine. I think the key thing is that the Texas Department of Health, the CDC, really jumped on this. First cases of the cows being infected were on Tuesday. By Friday, they'd already picked up this person, sent testing to the regional lab. CDC confirmed by Saturday. So this was very rapid action.
All right, Dr. Gounder, thank you so much.